So today we're going to show you how to make a PVS impression. The first step that you're going to do is to pour a little PVS adhesive into a dampened dish, and you want to use a separate brush to paint onto the tray. You don't want to use the brush on the bottle cap because in a live clinical situation you may cross-contaminate between the bottle and then the tray. So with the separate brush, you're going to paint adhesive pretty liberally all over the tray, ensuring you get some onto the lip and also on the inside of the tray. So you'll do that for your upper and lower trays, and you want to let that bench dry for about 10 minutes. You want to wait at least 10 minutes for the adhesive to reach its maximum adhesive properties. So you want the adhesive to be able to hold in your impression material as you remove it from the mouth, because it takes some effort to actually separate the impression from the teeth. So here's on the maxillary tray. So once you're done with the PVS adhesive and you're letting that bench set, what you want to do is take a little Surgilube and lubricate just the soft tissue portion of your typodont. So anywhere that's pink, rub some of that on so that it'll be a little easier to remove the impression once it's set. And you want to ensure that none of it gets on the teeth. If it does, just take a little 2x2 gauze and you can gently wipe that off. It's important to note that you're only doing this in the sim clinic environment. In a real clinical situation, you don't need to put this lubrication onto the patient's soft tissue. So we want to prevent PVS from getting all over your mannequin's mask. So to prevent that, we're going to grab a headrest cover and insert it into the mannequin's mouth. At this point, your articulator is going to be still in the mouth, but you have removed your typodont teeth. So the typodont teeth are magnetized, so they'll be able to snap right into place through the plastic. So you'll do the same for the opposite arch, and you'll find that the bag will catch any PVS that may leak onto the inside of the bag. You also want to position the bag so it covers as much of the mask on the outside in case any PVS spills over during the impression making process. So let's go over impression making technique real quick. What you want to do is use your mirror to retract one side of the cheek, and use your tray, have it sideways, and use the side of the tray to help retract the other cheek, and you want to rotate it in place. You want to check for the anterior posterior position of your tray so that's centered where you want to be, and you notice how the fingers move to the front of the mouth and retract the lip. And once you can see clearly that you're properly centered, then you want to go ahead and seat the tray evenly. And when you're doing this in the patient's mouth, you want to make sure that the lips and cheeks go over the tray. You don't want it to get caught underneath. So before you make your impression, you want to bleed just a little bit of material from the cartridge onto a piece of gauze. This is to ensure that you have fresh material that comes out of the tip. So after you've bled both cartridges on your light body tip, you want to just clip the end of it so that you have a larger opening at the end so material comes out a little easier and faster. So now you're ready to make your PVS impression. So you're going to grab your partner and they're going to bleed the tip a little bit before they load your tray of medium body PVS. Then you're going to take your light body with the curved tip and you're going to inject directly onto the occluding surfaces of your typodont. So in the posterior you want it on the occlusal surface, and on the anterior you want it on the linguals. So you want to make sure that the light body captures all the fine surface detail of your occluding surfaces. The light body tends to have a lower viscosity, so it tends to flow a little bit more, whereas your tray material is what we call a medium body, and it's a little bit more rigid and provides rigidity so that when you pull the impression material out, it prevents some distortion. So now you want to take the tray, again retract the lip and center your tray, and you're going to seat it, and you want to make sure as you're seating that you get the cheek and lips out of the way and that some of that PVS material goes beyond the free gingival margin, maybe about 5 millimeters beyond, so you make sure you capture some of that soft tissue. So when you go to remove the impression from the mouth, the teeth will come with it, which is okay because it's a Typodon. Now, in order to prevent distortion of your impression, you want to very quickly snap the Typodon out of the impression. So the next step is to head back to the lab, and we'll pour the impression in some microstone. What you want to do is measure out your water. So it's important to get the correct water to powder ratio. So we have 40 mils of water for 1 packet of microstone. So we'll add the microstone, and in the instructions you'll see here, hand mix for about 10 to 15 seconds, and we'll vacuum mix for about 20 to 30, and then we'll have a working time of about 5 to 7 minutes. So powder to liquid, and always go slow in the beginning until it kind of incorporates together. So again, you got about 10-15 seconds to do this. Okay, so once everything is starting to mix, what you can do is put your lid over. Okay, the little tube, there's a hole here that connects here, and then you'll turn it on the little switch, and then this part goes in, and what you want to look for is this dial to hit the green. That means it's under vacuum. So you want to do this for about 20-30 seconds. So it'll pull all the air out so you get a homogeneous mix. So that's about time. And then what you can do, it's got a little vibrator here, but we have one on the table too. And the idea is you want to gather all this together. So it's important don't forget to clean your lid when before it sets, otherwise it's going to be stuck on there. So now we have the vibrator on. We have our vacuum mix microstone, and of course we got a plastic cover to protect it. I like to start in the back, so you'll put the impression onto the vibrator, and you'll start with a little bit in the back, and you just want to see it flow into the teeth. So you just work your way all the way around, and you want to ensure that you don't trap any air bubbles. If you got a little air bubble, you can kind of work it out. But let the stone flow kind of on its own. As you add more, you can change the rate in which it flows. So you want to get too far ahead, you want it to kind of flow, and then you can vary the rate of flow by how hard you push on the vibrator. So right now I barely have it touching, and if I really push, it can accelerate the vibration of the stone. So once you got the teeth covered, you're probably in good shape. You can start to layer on some more. Okay, so about 5 to 7 minutes before this stone starts to set, and you can use a whole packet here. Okay, so I'll gather the rest of this stone. You can put this part on the vibrator, and it'll pull everything to the bottom. And for this first layer to adhere to the second layer, once you got it poured, what you can do is have these tiny little features here, kind of little dollops of stone that will allow you to have a little some mechanical retention of the two layers. But at this point you want to wait for the stone to set just a bit. We'll put it on the little tree there until it kind of starts to lose its gloss. And careful when you set your tree on, because if the table is under vibration, a lot of times the vibration as it's setting will cause it to slump like so. So the easiest time to clean is when the stone hasn't fully set yet. So right after you're done pouring, what you want to do is run it under water. Okay, if you forget about it and it sets, you're in trouble because the stone is very difficult to remove from the bowl. So really just under water, get your finger in there and just kind of wipe it down, and it'll dilute the stone. And make sure you kind of get all the stone that may be stuck on the bottom. So the reason why these get scratched up is because we try to clean the set stone off. So it's just best to prevent that from happening. So this bowl and spatula are clean, and then the lid, same thing here. So always do this before it sets. Alright, so at this point we have a more stone and we have your base former. So for your mandibular impressions, you're going to use the ones with a straight or flat front end. We have for the maxillary arch, you have also a set of 3 that has a more pointed end. Okay, so for the size of your trays, we're probably going to use the large one for the mandible. What you want to do is essentially just fill the base former with stone, and then we're going to layer our previous pour on top of that. When you're ready, you want to invert, and then it just plops on top here, and you just want to make sure the 2 kind of meld together. Alright, so the gypsum has set. Now what we need to do is remove the base former. So we have the alginate here. This should just tear off. If there's any stone coming over onto the plastic, what you can do, it should be fairly thin, just very gently kind of chip that off and expose. You don't want any stone around plastic. All you want to see is stone and PVS. Okay, so that should just peel away. So I just want to show you the junction here so you can see plastic all the way around. There's no stone caught in there. Here we got a little bit that should be able to just flick out because it's real thin, and these thinner pieces. Okay, so the PVS is an elastomeric material, meaning it should flex when you pull it out. So what you want to do is take it from the handle, and that should pop out. Okay. Okay, so once you've got it removed, what we want to do is trim the cast so it looks nice and neat. Okay, so you can see how we did the alginate, how this area is much smoother, right? So what we're going to do is soak your cast just for a couple minutes in water. Okay, what that does is the wet strength of this stone is much weaker than when it's in the dry state. Okay, so probably a couple minutes is generally enough, so keep it wet. What we'll do then is you want to trim this to the land area so you can kind of see where the junction of that typodon is, and that's where we want to trim it to. So make sure the shield's down, this will turn on. Okay, so you can see the junction. We're trying to get rid of that. So you see there? So the important thing is not to trim any of the teeth off. Okay, so you want to pay attention to where your teeth are. You don't want this, the diamond wheel to nick any of your teeth. Okay, so we'll turn this off. After you're done grinding, what's real important is to rinse this off with this little hose here so the stone doesn't accumulate onto this model grinder. Alright, so we're going to show you how to trim the land area on your cast here. So we're going to take this shield. This is going to go onto your vacuum unit. So there's a little slot that you got to line up to it. On the side, right next to your sim man unit, is a little switch in the center console. You want to flip that on, and this will turn these lights on. So you can push this button, and this will change the intensity of the vacuum. Okay. You want to turn on your unit, obviously. We're going to take your straight handpiece, and this fits onto the motor. And onto the straight handpiece, we're going to put this stone burr here. Okay. So it's cross-cut and it's real aggressive in its threading. So that slides in and to lock it in place, just twist. And this will lock it, and just make sure that you got it properly locked. Yeah. Okay. So we're going to take our cast here, and then we're going to run the handpiece to smooth out this land area. So we're just going to go around. You can hold it close to the vacuum just to flatten out any rough areas. So you want to run it by the land area just to get things nice and smooth. Okay, to make things really nice, you can go back to the lab and take some sandpaper and smooth things down. But that's essentially what we're trying to accomplish.